You are watching Channel Y. Channel Y, a South Asian Canadian channel.
Hello, everyone. You're watching Y Media. I'm your host, Shelly Seni. I am joined by MPP Robin Martin. She is the Parliamentary Assistant to the Minister of Health. Welcome, Minister.
Thank you. I'm delighted to be here.
Minister, the government has been rolling out a lot of schemes for the Ontarians, specifically keeping in mind the healthcare of the people of Ontario. And I believe there is an exciting announcement up ahead. Can you give us some details?
Well, yes, yesterday, actually, the Minister of Health, Sylvia Jones, announced our Your Health Plan, a plan for connected and convenient care, which has a whole bunch of initiatives in it, some of which have already been announced and some of which will be announced over the next little while. But we're working very hard to make sure that Ontarians have the care they need where and when they need it, and make sure that care is more convenient, more accessible. So that really means in your community, close to you, so you don't have to go too far out of your way. And, not everything has to happen in the hospitals. So we're trying to make sure that the care that can be provided in communities is provided in communities. For example, recently we announced that pharmacists could prescribe for 13 minor ailments. And this has been very popular with people. I understand some 40,000 people have already, since January 1st, used their pharmacist to assess a minor condition, and 30,000 prescriptions have been issued by those pharmacists to treat people, which is really convenient for people because pharmacies are pretty much everywhere.
Absolutely. And one of the points that really interests me and piqued my interest was that the information of one client would be transferred from one healthcare provider to the other without the person having to go through the details all over again. Now, I believe we are in Canada in 21st century. This should have been done much earlier. Why did it take so long?
Well, it's a long history of digital health records and trying to get digital health records to be very available to Ontarians and to Ontario healthcare providers. And frankly, there have been efforts over the years, but a lot of the work was done sort of entity by entity, like hospital by hospital. And the problem is that some of the records have not communicated with each other. But Minister Elliott, who's our Minister of Health before Minister Jones, who is now our Minister of Health, started a program for digital health. And what they're talking about is making sure all those systems talk to each other. And you might remember we announced the Ontario Health Teams. And so this is all about integrating our care so that people don't have to repeat their health data every time they talk to a different provider, that the data is available there. Because I don't know about you, but sometimes, I might forget to mention something that is important. And so it's important that the record go with the patient. And that's what we're working to make sure happens. As you say, we're in the 21st century, so let's have it.
Absolutely. And this will definitely streamline the entire process. Speaking of process and the health crisis, Minister Tabolo was recently in India where he made a statement on Ayurveda, that Ayurveda can actually play an important role when it comes to addressing some healthcare issues. What are your thoughts on that? And is the government working on those lines?
Well, we are always looking for new and innovative and bold solutions. And that's why Minister Tabolo and other members of our cabinet have been out traveling the world and finding out about what they're doing in other places, which will be useful here. And Minister Jones said yesterday that Ontario needs to look at the best of what happens around the country and around the world, and take the best of those solutions and implement them here in Ontario. We shouldn't think that if something's working somewhere else, it's impossible for us to do that here. We should look at those solutions and say, look, that seems to be working. Let's try that here and adapt it to fit Ontario. So I think that's what Minister Tabolo is talking about. I fully applaud the government's approach to look for innovative solutions, because we know that the status quo is not working.
Absolutely. Portable health benefit was also highlighted in yesterday's announcement. If you can give us more details on that, and can people expect it in a few months down the line, this year? When can they expect the benefits?
My understanding is that the expert panel that the Minister of Labour, Monty McNaughton, had consulted with reported, I think, late last year, and that they expect to have something ready by the end of this year, at least within 2023, hopefully sooner, like earlier in the year. But the idea would be that for people who don't have benefits, for example, dental, vision, etc., they would have a benefit package that goes with the worker rather than a benefit package that comes with the employer and stays with the employer. And so this will be hugely beneficial to people, often healthcare providers, frankly, who work in different places and don't get that benefit package. And it will help people to stay healthier and therefore help alleviate the pressure on our healthcare system. So all of these things are important initiatives, and it's important that the government look across the different ministries like labor, like health, like community and social services, and work together with them to find solutions, because at the end of the day, we're all here to serve the people.
Well, thank you so much for talking to us, Minister. And before I let you go, do you have a message for our audience?
Yeah, my message would be that this is a plan to connect our healthcare system with 3 pillars: right care in the right place, faster access to care, and finally hiring more healthcare workers. We all know that's the foundation of the system. So this government wants to find solutions and make things work for the people of Ontario so people don't have to wait as long. And that's what we're working on. And we're all ears for great ideas. So do let us know if you know of an innovative solution that is going to make a difference, because we want to know.
Well, thank you so much for talking to us.
My pleasure. Thank you.
You are watching Channel Y, a South Asian Canadian channel.